Hi, this is Ellen from Tissue Viability. This week, the 11th to the 15th of October, is Legs Matter Week. So we're just going to do a short video on all things legs. So we're going to be looking at the skin, the shape and the feel of your legs. So when we take our first check, we look at the skin. So we're looking at, have you had any cuts or bites or abrasions that have been there for longer than 2 weeks and have not showed any sign of healing or have deteriorated. Any heat or redness, that could show signs of infection, and these are things that you need to be going to your GP or your practice nurse to be checked out initially. If you notice that you have dry, flaky skin to your legs, just wash your leg in a bowl of water, or when you're in the shower or the bath, give it a little rub with a face cloth or a sponge to help to get the flaky skin away, and make sure you moisturise using any moisturiser that you can buy over the counter. It doesn't need to be anything special. Just use it twice a day, making sure that you cream downwards to prevent any hairs from becoming infected, and that will help to keep your skin healthy. Another form of dry skin is what we call hyperkeratosis, where you get really thick, hard plaques of skin to your legs. It's important that we make sure we do get rid of this before it gets to this point, because we can get germs and bacteria hiding underneath the plaques of skin, and that can form leg ulceration. So it is important that you wash and cream your legs daily to keep the hyperkeratosis at bay. Okay, we're now looking at check 2, which is the shape of your legs. Not everybody has a normal, as we would call normal, shaped leg. Some people have a very thin, narrow leg all the way down. Some people have what we call a champagne leg, where you have a bulging calf and a tiny ankle. And some people have quite thick, stocky legs where they've got no ankle at all, which, the common word for that is a cankle, which I have myself. So it's making sure that you check the shape of your legs, and if there's anything abnormal, again, go and get it checked out. Looking at the shape of your legs, you also need to check for any swelling that may occur during the day. This is called edema, and if you press into your leg and it indents, that's called pitting edema. And again, that is something that you need to go to your GP and have looked at. You can help yourself with some leg elevation, and elevating the base of your bed just slightly so you have a gradient when you're sleeping, and that will help to reduce the edema. Check 3 of the 3-stage check is feel. So you're feeling the back of your calves, making sure they don't feel hard or you're not getting any pain. Another thing that you may get is when you're walking, you may get cramping in your calves, which makes you stop for a few minutes and then you carry on walking. Or if you have to get out of bed at night or hang your leg out of bed, or even some people put their legs on a cool radiator to try and stem the pain, then you really do need to be going and getting that checked out at your GP surgery, because you may require a vascular referral to have further investigations. Should you require any further information, if you're concerned about your legs, please visit legsmatter.org or do make an appointment with your GP. It is important that we get to these matters sooner rather than later.